Have you ever had pain in the soles of your feet after standing for a long time? Or walking long distances? Or after a long party where you didn't stop dancing in heels? Didn't it happen to you that next day you couldn't even walk? If you answered yes, it means that you experienced an episode of acute plantar fasciitis. But what is acute plantar fasciitis?
Well, the plantar fasciitis is an alteration of the anatomy and physiology of the plantar aponeurosis due to overuse or hyperextension, which cause tears with distorted tissue and inflammation with collagen fibers. The plantar fascia originates from the posterior medial calcaneal tuberosity and inserts into the base of the proximal phalanx of each toe. The plantar fascia is inelastic with proximal elongation of 4%. The etiology are microtrauma of the aponeurosis, occupational or sports. It's more frequent in adults. The peak age of incidence in general population is between 40 and 60 years. In one tier of cases involves both feet is prevalent in people with seronegative arthritis because many have visage and the site of attachment of tendons or ligaments to bone.
Risk factors: body mass index greater than 27 kilograms, excessive running, for example, military personnel and runners, intrinsic foot and calf muscle tightness, shortened Achilles tendon, weak intrinsic muscles of the foot, weak plantar flexor muscles, length discrepancy, occupations requiring prolonged standing or walking, pes cavus or high arch feet, pes planus or flat feet, reduced ankle dorsiflexion that causes the foot to overpronate, causing more load to be placed on the plantar fascia, sedentary lifestyle, deconditioning, hard surface, walking barefoot, wearing high heels for extensive period of time, inadequate stretching, poor footwear, and prolonged weight bearing. Pathophysiology. The microtrauma or repeated elongation causes tears of the aponeurosis, which can also cause bone wear with subsequent formation of calcaneal spores. Acute plantar fasciitis, 3 weeks or contracture phase without inflammatory reaction. Subacute fasciitis, 3 to 8 weeks, with inflammatory reaction during or after exercise. Chronic fasciitis, more than 8 weeks, with inflammatory reaction at rest.
The clinical manifestations are severe pain in the ankle, burning pain, limp, hypersensitivity, plantar muscle contracture, and erythema.
How can a doctor diagnose plantar fasciitis? Easy, by your symptoms, or by taking images like X-ray, tomography, or resonances, where you can see the inflamed or thickened plantar aponeurosis, even with bone formations.
But not panic, there is treatment for this disease and it's not only injections and surgeries. The most common treatment are physiotherapy, repose, templates, NC8IDS, glucocorticoid injection, magnetic pulse waves, surgical removal, and the most frequent complications are calcaneal spore formation in case of chronic plantar fasciitis.
Differential diagnosis diagnosis of plantar heel pain, medial calcaneal and abductor digitiquity nerve entrapment, which it presents with pain and burning sensation in the medial plantar region. Neuropathies. Tarsal tunnel syndrome, acute calcaneal fracture, calcaneal apophysitis, calcaneal stress fracture, calcaneal tumor with deep bone pain, ankylosing spondylitis, Reiter syndrome, osteoarthritis, systemic arthritis like rheumatoid, fat pad atrophy, Achilles tendonitis, retrocalcaneal bursitis, Baxter neuritis.